for this program to be a success, we'd have to have very special kinds of people to innovate and to initiate this program.
It was a really special time, and it's wonderful that the high-risk youth program is still here, that the division's here, and that all of these programs have come out of that.
30 years of the high-risk youth program, an amazing program that was started by true visionaries through Children's Hospital Los Angeles.
We created a space that runaway and homeless youth knew was a safe space.
It's hard to imagine Los Angeles without a high-risk youth program, but back in 1980 there was just no services for young people outside of the traditional healthcare system. And free clinics were developing, but they were not addressing some of the needs of the high-risk youth. And so I had this idea of developing a system of care where we had multiple entry points into a healthcare system which included health, which included social, which included residential, which included counseling, and that's how the high-risk youth program came into being.
The collaboration has been beneficial to both organizations, and it speaks to our mission of serving the underserved and of being a safety net without judgment and the ability to pay.
It was our initial community program that actually utilized an interdisciplinary model of care, which means we used physicians, nurses, psychologists, health educators, social workers, all working together to meet the needs of these complex, homeless and high-risk youth.
The program really reaches out to have unorthodox approaches and really focus on the engagement of youth. We don't assume a kind of orthodox therapeutic experience where someone has to be sitting with us for 45 minutes to an hour. If a person can only meet with us for 5 minutes, or they want to meet with us for 5 hours and we're able to do that, then that's what I mean about it being low barrier and engaging them where they're at.
About 40% of the kids that we work with are gay, lesbian, bisexual, and transgender, and may or may not have been kicked out of their homes of origin anywhere in the country for that. It's our job to accept that, to work with them on that, and to get past whatever barriers have held them back from getting ahead in life, whether it's school or job. And many times I think the youth are surprised that that's not an issue for us here.
So our goal really is to provide high quality medical, behavioral health, and case management to these young people and provide them with a safe space to come to get their needs met.
The high-risk youth program in the 10 years I was there was one of the very best programs that I'd ever seen implemented. It was effective, it was comprehensive.
I mean, I worked in the program from 1988 to 1995, and so you really become connected to so many young people. I can't even tell you how many young people I've worked with.
The thing that was so different about the high-risk youth program was that it was really this team effort, and there was this multidisciplinary group of people, of professionals who all worked together trying to have an impact.
As we started becoming more sophisticated in our work, we started adding new services to our complement of service delivery. So we added substance abuse prevention and treatment folks to our team. I moved into a role overseeing our HIV program, and we started offering HIV testing and screening and education as part of our services.
Our program itself became internationally known. We had visitors from all over the world, all over the U.S. coming to see how we took a community and we formed a resource within that community itself without establishing a one-site resource.
Because that program got started in 1982, thousands and probably now tens of thousands of young people who were homeless, chronically homeless in many ways, on the streets here in Hollywood and the larger greater Los Angeles area, were able to find a stable way and get off the streets. And we did some studies at the time, and they stayed off. That's a real testament to what the high-risk youth program was able to do.
developing these community relationships.
It has made a difference for many, many people.
Continuing to provide amazing care.
This program has just always attracted the most remarkable group of folks.
That was the vision, and they're all visionaries. And so for us to be here 30 years later is not really a surprise because this was the vision.